Good afternoon or good morning, everyone. Warm greetings to all parts of the world connecting today. Welcome to this event titled Plasma Policy Insights, Navigating Challenges and Solutions. My name is Michaela, and I have the pleasure to accompany you today during our proceedings. On behalf of the United Nations Institute for Training and Research, shortly UNITAR, let me welcome you to this event, which is co-organized with Abbott as part of the Plasma for Life initiative. This initiative's overarching goal is to improve patients' access to plasma and plasma-derived medicinal products, and so it's the goal of these events as well to approach us to this. Thank you, everyone, for your interest in this topic, and we are very glad we can meet here today. I would also like to extend a warm welcome to our distinguished speakers who kindly agreed to share their expertise with you. So let's have a quick look into today's agenda. We will start with opening remarks from the organizers, Mr. Mejia and Dr. Hugh. And then we will hear three presentations from our speakers and then move to the panel discussion. I would like to let you know that you can post your questions via the Q&A feature, and our speakers will have the opportunity to kindly answer in written directly in the Q&A window. We also plan to collect the questions and address them later on our website, Plasma for Life. I would also like to announce that this webinar is being recorded. And now, without further ado, I would like to play the welcome message from Mr. Alex Mejia, the Director of the Division for People and Social Inclusion at UNITAR. In addition to this role, Mr. Mejia serves as the director of UNITAR's global network of 34 training centers called CFAL. His career spans 2 decades in private and public sectors, including corporate banking, as well as diplomatic service of his country, Ecuador. He's a former vice minister of economy for Ecuador and has represented his country at the IMF and World Bank. So now I would like to share his message with you.
Ladies and gentlemen, distinguished guests, esteemed colleagues and friends. It is my great pleasure to welcome you all to today's important discussion. This event serves as a vital platform to examine and exchange insights on the diverse policies governing plasma collection, processing, and distribution that very much impact the availability of life-saving plasma-derived medicinal products worldwide. I would like to extend a warm welcome to our distinguished panelists and participants who have joined us from across the globe, representing a diverse array of expertise, from policymakers and healthcare professionals to patient advocates and industry leaders. Your presence here today reflects our shared commitment to fostering collaboration, driving meaningful progress in plasma policy development, and ultimately in improving the lives of patients who rely on plasma-derived medicinal products. I would also like to express my sincere gratitude and that of the United Nations and of UNITAR to Abbott Laboratories for co-organizing this event and for supporting us all the way. Your partnership has been instrumental in bringing us together for this vital conversation and is ensuring that we can indeed collectively work towards improving healthcare systems and policies. At UNITAR, our mission indeed is to advance inclusive solutions that leave no one behind through capacity building. This commitment aligns seamlessly with today's discussion, where we aim to provide a space for mutual learning, uncovering best practices, and exploring strategies to strengthen global healthcare systems and improve access to essential therapies for all. As we begin, I encourage each of us to take the opportunity to identify actionable solutions and pathways for progress. Together, we can contribute to the development of robust, equitable policies that ensure no patient is left behind. Again, in the most sincere manner, thank you to all of you for being here today I wish you an enriching and successful discussion. Thank you indeed.
Thank you very much to Alex for the welcome message. And now I would like to turn to Dr. Hugh Nguyen, the Managing Director, Asia Pacific Transfusion Medicine at Abbott Core Diagnostics. Dr. Hugh brings over 18 years of experience in the diagnostics industry, including leadership roles at Abbott and also other healthcare companies. As Managing Director for Asia Pacific, he has successfully driven business transformation and team development across the region. And Dr. Hughes, you have the floor.
Thank you, Michaela. Distinguished guests, esteemed colleagues and friends, welcome to an event that promises to be both enlightening and transformative. Today, we gather to explore the critical landscape of plasma policies, a topic that holds the potential to change lives across the globe. I want to start by extending my heartfelt thanks to Mr. Alex Mizia, the Director of the Division for People and Social Inclusion at UNITAR. His dedication and the relentless efforts of his team have made this gathering possible. Our mission today is clear. It is to enhance the access to plasma and plasma-derived therapies. We will delve into crucial topics such as cross-border plasma transfer policies, the harmonization of regulatory landscapes, national plasma policy initiatives, technological advancements, and of course, addressing patient needs. This event will highlight the innovative approaches of various countries, from those with robust policy to those striving to develop effective strategy. At Abbott, our commitment is to make a meaningful difference in people's health and well-being, helping them achieve fuller, healthier lives. We are very proud to support UNITAR in this noble endeavor. Our partnership aims to advance healthcare and ensure that essential plasma-derived therapies can reach patients worldwide. This collaboration is a testament to Abbott's dedication to improving lives and pushing the boundaries of healthcare. I also want to express my deepest gratitude to our distinguished international speakers and the panelists. Your presence here from various corners of the world, including policymakers, healthcare professionals, patient advocates, and industry leaders, is invaluable. Thank you for your dedicating your time and expertise to this cause. Together, let's embark on a journey of discovery, learning, and progress. And I'm very confident that our discussions today will pave the way for significant advancements in plasma policy. With that, I would like to say thank you again, and I wish you all a productive and inspiring discussion ahead.
Thank you very much, Dr. Hugh. It was a very nice message and inspiring words. And now I hope you look forward as much as I do to hear from our speakers. And I would like to introduce the first one, Dr. Yoon Marioningse, the team lead for blood and other products of human origin, Technical Standard and Specifications Unit, Health Products Policy and Standards Development at the World Health Organization, headquartered in Geneva, Switzerland. Under Dr. Yoon's leadership and coordination, the WHO has drafted important documents such as guidance on ensuring sufficient blood and blood components during emergency situations and many others. And now she will present as a new document that will be published soon, the guidance on cross-border plasma transfers. So Dr. Yoon, you have the floor and we look forward to your presentation.
Thank you, Michaela. So I will try to share my screen. I hope you can see my slide from the screen.
We can.
Okay, good. Yeah. Good morning from Geneva and good afternoon for colleagues. So first of all, I would like to say thank you to UNITAR, Plasma for Life, and ABET for inviting WHO to this important meeting. And also, I would like to say hello to all the panelists and all the speakers. And also I would like to send a special greeting to Professor Dr. Taruna Ikra. Salam kenal, Pak, dari saya, because I'm also from Indonesia. So in this important meeting, I have already requested to explain about our new document. So the document is the policy guidance on implementing cross-border transfer of domestic plasma to obtain plasma-derived medicinal products or PDMPs. So in this meeting, I will try to explain the topics which is included in the document. So the document consists of 8 chapters from introduction, background, donated plasma as a national resource, ethical concern regarding plasma exportation, legal and policy concern, strategies to protect health of plasma donor, alternative arrangement for fractionation, and also conclusion and recommendations. So first of all, of course, I would like to explain the background of WHO to develop this policy guidance. In 2020, in February, we established a strategic direction. We established the action framework to advance universal access to safe, effective, and quality-assured blood products. This document serves as a strategic direction to global effort to address present barriers to safe blood. And one of the challenges identified is the lack of availability of plasma-derived medicinal products. Therefore, this document proposes 6 strategic objectives, in which the strategic objective number 3, functioning and efficiently manage blood services, is related to the topic that I will explain today. So the outcome of the strategic objective number 3, there are 4 outcomes. And one of the outcomes is the availability of the volume and quality of plasma for PDMPs is increased. And through this strategic objective, we are mandated to establish the guidance on increasing supplies of plasma-derived medicinal products in low and middle-income countries through fractionation domestic plasma. So soon after we published this document in 2021, ISBT and WHO conducted a webinar to disseminate the information regarding this guidance. And in 2022, ISBT and WHO developed or established a collaboration agreement to advance access to safe plasma protein products in low to middle income countries. Both of us identified that a common barrier to the fractionation of domestic plasma in LIMEX is a governmental, legal, and policy prohibition against the exportation of plasma. And ISBT, supported by BTT is my team, come up with the idea to establish a policy guidance on exportation plasma to obtain plasma-derived medicinal products. So the aims of the policy guidance is to provide a global strategy in utilizing recovered plasma and source plasma for the production of PDMPs through contract or terms as contract or toll plasma fractionation. So the document highlights the concern underlying prohibition against the cross-border transfer of domestic plasma and also examines the existing barriers to plasma exportation and provides the rationale for policy decisions regarding the fractionation of domestic plasma to enhance the availability and affordability of PDMPs. And additionally, this document also recommends measures to overcome barriers to the cross-border transfer of domestic plasma, defined as the shipment of domestic plasma to a manufacturer in a foreign country under a contract or fractionation agreement. So chapter 1 is talking about the background. The shortage of PDMPs in low to middle income countries is leading to preventable morbidity and mortality among patients with hereditary and acquired plasma protein deficiencies. So policy guidance is essential for developing a global strategy to utilize recovered plasma that not used for transfusion, as well as source plasma for the production of PDMPs. And in line with the World Health Assembly resolutions, the WHO advocates for plasma collection from voluntary non-remunerated donors. Plasma donation should maintain financial neutrality, consistent with the principles that promote ethical practices in the donation and management of medical products of human origin. And we also explain that there are countries resistant to cross-border transfer of domestic plasma. So the country concerns regarding cross-border transfer of plasma, which becoming the challenges for the country. Authority, in which if all of these are in place, so the country will enable to transfer the domestic plasma to other countries fractionation. And then the second challenge is the economic considerations regarding allocation of resources across the healthcare system. Ethical concern for plasma transfer is also becoming another challenge, and donor health arising from the need to collect more plasma also raised up by some countries to become a challenge, and lack of information or analysis of which model is appropriate in the national context is also becoming a concern of the countries. So from the fractionator, there are also some concerns which related to factors preventing the collection of adequate volumes, lead to the inefficient plasma collection and processing. So the factors are insufficient equipment that lead to the delays freezing of plasma within specified time frame, and also fragmentation in blood system, which exists in most of the low to middle income countries, will lead to the increased cost of maintaining and certifying GMP compliance. Inadequate transport infrastructure is also a concern from the fractionators, because this factor will hinder plasma move to fractionator. Fractionators is the quality and safety of plasma practices, either on the practices aspect and also on the documentation aspect. So the factors are first design and layout of the blood establishment. So we know that there is a need to have a suitable design and layout of blood establishment to provide quality and safety of plasma, and also to enable the blood establishment to function efficiently. And then another factor is the personnel. So the hiring trained personnel and maintaining qualified staff is really important. And then quality control, periodic quality control testing is also need to be in place. Traceability, this one is the bidirectional traceability. So from donations to end product is also need to be in place. Equipment and procedures, including validated of equipment, reagents, medical device and procedures, donor management, including the recruiting qualified donor, maintaining regular donor, check of donor eligibility is also important factors. And then, of course, testing for infectious disease on the plasma is also very, very important. Safety measures for collection and also the collection and storage, for example, the timely collection, standardized freezing condition, appropriate storage facilities, as well as transport conditions. And then chapter 2 is sorry, I cannot see this. Yeah, chapter 2 is about the donated plasma as a national resource. So we are all aware that currently the need for PDMPs are globally unmet. So the government-supported program that recognizes the medical and economic value of domestic plasma as a resource for manufacturing PDMPs actually can help to mitigate unmet patient needs. Second factor is failure to diagnose inherited and acquired disorders. So for this aspect, I think the education for the clinicians on finding what kind of disease that actually can be treated by plasma-derived medicinal product is also important. And the non-national commitment on availability and affordability of PDMPs. For example, there is no strategic national resource. So this will lead to the surplus plasma is discarded and access to PDMPs is not part of the public health goal. And then the last factor is no national blood and plasma program. Actually, this program is really neat to set standard for plasma preparation, to coordinate movement of plasma, to negotiate contract plasma fractionation, and to authorize importation of PDMPs. So chapter 3 is regarding the ethical aspect on plasma exportation. So the ethical acceptance of cross-border transfer of domestic plasma depends on assurance of donor safety, as well as depend on respect for autonomy, non-maleficence, beneficence, and justice. So for example, if we don't use the plasma, then it means we are failure to respect the autonomy and beneficence of the donor. And then also the ethical acceptance depend on optimal use of blood and plasma to benefit patients. For example, through linkage to access to essential PDMPs or use of plasma that would otherwise be discarded. And also depend on management of the blood and plasma system to prevent negative social and economic impacts that might undermine access to safe blood for transfusion. And lastly, of course, donors should be informed that PDMPs manufactured from their altruistic donations become economically valued products that have cost. So the next chapter is about the legal aspect regarding plasma exportation. Plasma needs to be of sufficient quality to be accepted for fractionation. And also plasma need to be transported to the fractionator in a different country. So that is why the good delivery practice need to be in place. PDMPs are to be imported to the plasma supplying country. So WHO really encourage country not to only sell their plasma to the fractionator, but in return, they have to get the PDMPs for treating the patient in their country. So to support this aspect, of course, the regulatory agencies need to have a legal mandate to license and inspect the blood establishment, and if necessary, to sanction them in cases of misconduct. Traceability is important, so plasma master file and this requirement should be addressed in a national hemovigilance and pharmacovigilance system. Corresponding legal requirements need to be in place or need to be established to permit this cross-border transport. And lastly, the customs personnel need to be educated and trained. The next chapter is strategy to maintain the health of plasma donors. So the aspect regarding, including in the strategies is aspects on donors, testing and donation centers. So some aspects regarding donors, for example, these are obligation for donors to be screened, protect the donor from adverse outcome of donation, inform the donor on abnormal findings, donation frequency must be regulated, recommendation on limited compensation of plasma donors consistent with financial neutrality. So for example, reimbursement costs for the donor should be limited only to replace the time lost for donor to donate their plasma. And also another example is to give replacement of the transportation costs. Requirement to track and report any adverse health events associated with the plasma donation. Aspects regarding to the testing, for example, ferritin testing can be added to hemoglobin testing. And of course, measurement of total serum protein and IgG is also important. And plasma need to be tested for infectious disease before can be manufactured into PDMPs. So for donation centers, some factors that are important is inspection and certification and or licensure of facilities collecting plasma, mandated staffing of plasma donation centers by licensed medical professionals, regular training and professional development for staff of plasma donation centers. Chapter 6 is talking about the alternative arrangements and economic consideration for fractionation of domestic plasma. So factors that need to be considered in choosing the alternative arrangements are national requirements, general regulatory aspect concerning plasma and PDMPs, PDMPs related factors, technical and quality consideration, as well as economic consideration. So possible alternative arrangements are running the contract or toll fractionation, sales of plasma to a fractionator linked to the purchase of PDMPs from the same fractionator within the same contract. So again, I would like to emphasize that the country that send the plasma need to get in return the PDMPs product. And also another possible alternative arrangement is public-private partnership. Establish a balance between whole blood or recovered plasma and resource plasma collection, regional fractionation hubs, in-country fractionation facilities, and hybrid models. Chapter 7 is talking about the WHO recommendation. So WHO recommended to remove a national or regional legal and or policy barriers to cross-border transfer of plasma designated for contract plasma fractionation. Of course, this recommendation can be run if the GMP in the country has been achieved. So this GMP compliance is needed to ensure the adherence to good manufacturing practice for quality assurance, and also donor safety should be in place by implementing safeguards to protect the health and safety of plasma donors. Legal enforcement also need to be established, in which this can lead to the establishes legal measures to prevent the importation of compromised product. And the last factor is scientific and regulatory assessment. For example, by conducting evaluation to compare risk of final products from different source plasma. Moreover, the WHO recommendation for plasma transfer are when plasma apheresis program exists, please avoid compensation over financial neutrality, and also need to set up the system-wide donor recruitment. And related to the patient access, of course, this will lead to the equitable patient access to PDMPs obtained through contract or toll fractionation. And cost reimbursement for procurement of PDMPs under contract plasma fractionation is also another recommendation from WHO, in which the sustainable national or regional budget commitment should be in place. The next aspect is donor information. As mentioned before, that the donor need to be informed regarding the economic value of PDMPs and also regarding health and survival benefit of patient due to the existence of plasma-derived medicinal products. And last factor is regarding the economic value. So the value of exported plasma can partly offset the cost of PDMPs. So I think I end this presentation. Thank you for your attention. And during the discussion, maybe I can answer your question. Back to you, Michaela.
Thank you very much, Dr. Yoon. That was most insightful, and I look forward to reading this guidance in detail. And yeah, very happy for your offer to answer the questions during the panel. And now I would like to introduce our next speaker, Dr. Christian Scherer, the head of Inspectorate of Swissmedic, the Swiss National Authorization and Supervisory Authority for Drugs and Medical Products. Dr. Scherer is also a member of the WHO Advisory Group on Blood Regulation, Availability and Safety, and the WHO Expert Committee on Biological Standardization. Dr. Scherer, we look forward to hearing your take on the international harmonization instruments for plasma policies, and you have the floor now.
Yeah, thank you, Michaela, and good morning, good afternoon, good evening all over the world. I start with trying to share my screen so that you can see the presentation. Please let me know if you
Yes, we can see it.
See it. Okay. So yeah, first thanks again for to UNITAR to give me the opportunity to discuss with you some harmonization aspects on this very important topic. I'm working for, as Michaela said, I'm working for the Swissmedic, which is a regulatory authority in Switzerland. And I have a lot of experience in that area, also in cooperation with WHO. However, just a short disclaimer so that all what I'm trying to tell you or share with you is my own views and is not necessarily the opinion of Swissmedic's position. As I said, I'm working as a regulator for many years, so I will try to give you mainly some insights of harmonizations among regulators. I know that this is mainly a bit driven from a European or Swiss perspective, but I think we have a very international cooperation activities, and it is quite similar in all over the world in many other areas of where we have national regulatory authorities. So typically, every country or every national regulatory authority has some kind of bilateral collaboration with partner authorities. It's quite useful to have some kind of mutual recognition agreements or memorandum of understanding with bilateral agreements to improve cooperation, to facilitate also the access of to medicines due to joint assessment decisions. So these are there are a lot of activities on that level. But of course, on the other side, there are Swissmedic or many other regulatory authorities have also multilateral cooperation, which are useful platforms where regulators typically regularly meet and try to work on harmonizing their approaches to harmonize the requirements, and that all should finally lead to facilitating the decision making by the regulators, but also improving and facilitating the access to safe and high quality medicines. I think from Swissmedic's point of view, I think we have some lists here that, of course, WHO is a very important partner in that area. On European level, we have the European Council of Europe, but there are also international platforms like ICH or the International Coalition of Medicines Regulatory Authorities. So as you can see, there is a whole bunch of platforms where regulators try to work together and are developing standards or documents that should facilitate the working together and also to facilitate industry of being active on a global level, as we have most of the pharmaceutical companies are globally active, the big players. So I think this is important. And when it comes to plasma and plasma movements, I think we've just heard from Dr. Yoon's presentation also the importance of facilitating cross-border movements of medicines, of plasma as a starting material, and to facilitate cooperation among private and public sectors in that area. I think I will, regarding plasma or product I have most experience, of course, in working together with WHO or in the Pharmaceutical Inspection Corporation scheme. So that's a network where almost 60 competent authorities are working together to facilitate the inspection and harmonize the inspection and the GMP requirements for manufacturing of medicinal products all over the world. So there are national regulatory authorities participating in PICS to regularly, and they are all from all continents of this world. So on European level, of course, Council of Europe and EDQM, European Directorate of Quality of Medicines, is also very active in the area of blood and plasma derivatives. So that is where I have my experience mostly, and I will go more in details on that. Why are regulators trying to work together? Because we all have also limited resources. We know that we need to work together, and we have to apply reliance mechanisms also to facilitate the working together, and that we can all do our job we need to do on a global level. We are not having the resources as regulatory authorities also to do everything on our own. So there is a high need and necessity to work together and to rely mechanisms of reliance, what is called today. Just as a background information, so I think it's quite clear that there are some key enablers that are important to facilitate these reliance mechanisms. There are aspects of regulation. So how do we regulate medicines? How do we assess these medicinal products when they want to become on the market? What are the requirements for that? And we need to have harmonized regulatory requirements, more or less all the same across regions, not only on a national level, but probably also on regions, or if possible on a global level. Of course, there are many other key enablers of working together to access and share information mutual between the different authorities, and having also IT or tools that facilitate our review or the collaboration among regulators. But what is important that if we can only rely on each other's work if we really agree on some harmonized regulatory requirements across the globe, or at least within a certain region. Of course, I do not have to repeat that WHO is a very important player in that area, especially when it comes to blood and plasma derivatives and regulations. And I think we could make a whole session just on what WHO is currently doing under the leadership of Dr. Yuyun. It's important that there is just to highlight, to mention the highlight, that there is an action framework in place, especially to work on that on a global level. Although it seems to be terminated till 2023, there is a new and extension of this action framework on the way. So the program will continue, and the achievements are quite surprising to see. And this new guideline that was just presented by Dr. Yuyun is just one of the examples. Of course, there is a lot of strategic thinking behind. I think you just see some points here that should also facilitate access to these important products, and to improve the organization on a local, national, or probably more regional level, to facilitate the access and the availability to the important plasma-derived medicinal products, but also to plasma and or blood components for transfusion. I think as the same will apply as we have the experience now on European or other level, that collaboration is key among the key players. So it's not just the regulatory authorities, it's also on the private or public sector that collaboration is important. And we have to work together and to share our knowledge and the information and the lessons learned, as this platform provides a very good opportunity to share some of the experience. Of course, we know, and Yuyun has just highlighted some of these challenges. There's still a lot to do, and there are always new threats, new influences on the political, but also on the scientific level or on the national level. I also would like to highlight a little bit the role of blood standards for harmonization, because that's where it comes then down to the requirements that have to be fulfilled. And these blood standards are really an important element in the whole blood supply and blood product supply organization, whether we are talking about blood components for transfusion or plasma derivatives. We should not forget about the donor safety in these standards, but also, of course, the objective of such standards to ensure quality, efficacy, and safety of blood and blood products. So it's always about the same, though there are many aspects. Still, we cannot repeat it sufficiently enough. That had already been presented by Dr. Yuyun. So it's all about quality, safety, efficacy, but also to donor safety aspects in that are important elements that should that we need to work on and to facilitate finally the availability of products. The main, if we try to identify the main standards relating to blood products, are essentially dealing with aspects of donor evaluation, donor exclusion, and just to highlight where we are there. So there's a good WHO framework available already. It is under revision, but finally it's something that needs to be supplemented by national or probably regional standards, because there is a lot of local or regional epidemiological data behind that should help to identify donor exclusion criteria depending on the local epidemiological situation. So we cannot have a fully global donor criteria applicable to every part of the world. There is still a lot of local or at least regional epidemiological data that needs to be considered in defining donor exclusion. So that has also its limits. So even if we are aiming towards having a harmonized approach, I think WHO is giving a framework, but it needs to be finally decided on a national or hopefully regional level to what are the donor criteria that should be applied. It's quite similar when we are talking about testing strategy, so testing for infectious disease risks or things like that. So this has also a lot to do with national or regional epidemiological data. What are the infectious diseases that need to be tested? What is the testing technology that is available in a certain area? But what are the principles can be applied and are defined on a global level by WHO on what are important elements of developing a testing strategy. When it comes to the good manufacturing practice, I think this is a quality standard, just defining what are the principles that need to be complied with when collecting blood, processing blood or plasma for further fractionation, but also what are the quality standards that are applied by fractionation companies to produce PDMPs. I think this quality standard is something that can be developed quite on a global level. So there is not too much. These are all well-known principles that can be applied and should be finally implemented on a global level. That will for sure facilitate very much the cooperation of plasma donation centers and plasma fractionation companies to develop toll fractionation or other kind of programs on that level. Having WHO, PICS, the Pharmaceutical Inspection Corporation, but also other European bodies in that area, working very much closely together. I think it is possible there, or we are already on that level, to have a global applicable GMP standards for the area of blood or PDMPs available. And I think that should be the objective, really, to go toward applying and using this global standard. when we are talking about GMP requirements. Of course, on the other area, there are also guidelines on how to use blood or blood products in an optimal way. I think there are quite a lot of also global standards available, whether it's patient blood management on one side, or whether it's licensing requirements for PDMPs when it comes to the approval for a certain market. So I think there are a lot of ongoing work to develop these standards and to further improve them on a global level, whether it's through ICH, the International Council of Harmonization, which is the main body on a global level to define requirements for licensing medicinal products, but also WHO, who has important elements of guidance in this area. Another topic which is probably we should not forget about is the regulation of the in vitro diagnostics level. I think there are a lot of ongoing work in the on the international level to define some common strategies on how IVDs could be regulated. Of course, currently there are more different approaches in the European setting, whether it's an approval system in the US setting. So I think there is still it's a young area on working together on developing harmonized requirements, but I think it's a very fast growing area, and it's a fast developing part of regulation that is also supported very much by activities from WHO, where the medical devices and in vitro diagnostics area is becoming more and more important, and more guidance documents will be available as well. So if we just have a look on where are we for donor selection, top standards, I think as mentioned, there is already a place, a WHO framework on donor selection. It will be updated because that's something which is developing continuously, and there are some very important well-known regional standards available on the European, but also on document which is used also in other areas of the world, like Australia, which is making reference to this European document, is the blood guide of the European Directorate of Quality of Medicines. But of course, this is then really on the regional level, and it may need to be adopted according to other epidemiological situations in areas of other places of the world. There are many national regulatory documents who are not developing their own, so they are making reference, for example, to such a regional document like the European blood guide, for example. This is just an example of an approach how countries are working together towards harmonizing their requirements on a regional level more than just on a national level. Yeah, I think there is already a good way of harmonization when it comes to donor selection, but there are probably still some missing mechanisms to further improve these harmonized approaches, and especially when it comes to areas which have less regulation in that area. I think there is still a great need to make big steps in that area to improve the harmonization of donor selection frameworks. It's a bit about the same for testing strategy. There is a good WHO framework available. There are some regional documents that are helpful and are part of the regulatory mechanisms already in place. Of course, it might still need to have some national risk assessments of certain situations. I think from my perception, there is less. There are less mechanisms in place really to make sure that these recommendations or these frameworks are really entering into a national or regional legislation. So there is still a lot of to do, I think, to make it clear what are the harmonized testing strategy in that area. Just as it go now down to the GMP, there is a GMP document or the good practice guidelines for blood establishments, and this is now harmonized, fully harmonized among the WHO, among European regulation about the PICS regulation. So that's really Council of Europe. So there is more or less 99% of the same regulation is in place. WHO will hopefully soon also issue the revised version of their GMP guide for blood establishments, which is really, let's say, the identical regulatory requirements for GMP for blood establishments. So that's why it's still in a draft version, but it has already been approved. So it's just a question of weeks until it will be published, hopefully soon. But the content is now really harmonized and has been agreed, let's say, on a global level for what are the quality standards for a blood establishment. The same is when it comes to manufacturing of the PDMPs on an industrial scale. I think also there European and PICS GMP is becoming more or less a global standard that can be applied, and so there is full harmonization already achieved. Having said that, of course, these are the standard. That doesn't mean that everything is implemented. So it's still a lot of work to do to implement full harmonization of these guidance documents or these documents that are available. I think we are all aware that there are still many unsolved challenges, and Dr. Yun has just highlighted some in connection with the plasma export cross-border activities. I think it's still very important that the political decision makers are aware of the situation and are aware of the importance of blood and plasma-derived medicinal products. And this also should trigger the awareness that a national blood regulatory system is essential, is key in addressing this need, in making sure that the patients have what they need. And so there is still a little bit a lack of awareness and misperception when it comes to the need and the decision to implement a national blood regulatory system. That leads to a very slow implementation in certain areas. I'm looking very forward to hear the discussion with my colleagues from Indonesia, which are in a perfect process in which I know a little bit because I've been there myself. And I think it's nice to see how they are making steps forward in implementing such a national blood regulatory system. I also would like to highlight the issue of self-sufficiency. Probably this is a little bit also a misperception of what is really where is self-sufficiency important? Is that something that needs to be done on a national level, or should it more be considered on a regional level? Is it the same for blood for transfusion or PDMPs? And I think there are also in the public discussions, in the awareness of decision making on the political level, I think there is not clear concept of what self-sufficiency means. I think we need to work more on a global level. We need to work towards harmonization, and maybe this self-sufficiency need to be defined on a different level, probably more on a regional level than on a national. I think cannot hide there is a lot of also discussions about between public and private organizations, public and private sector in that area. Of course, as Dr. Yun also highlighted, there is a plasma industry that that we need to produce these PDMPs, which are private organizations. They need plasma to be collected to cover the needs of plasma for further fractionation. And currently, there is still too much fighting between public and private organizations. And finally, the outcome of these debates between public and private is it leads more to divergence than convergence. And I think that should be also a point to be addressed and maybe to sit together and discuss what are the what is the best way forward to facilitate the access on that level. Otherwise, there's no sense to have harmonized regulations or harmonized standards if finally we do not implement that, or we try to implement that on two different levels. I'm still trying to sell a little bit the one donor concept, because whether it's public or private, it always starts with one donor, and finally it's not important whether this donor is donating blood for transfusion or whether this donor is donating plasma for PDMP manufacturing. We have to take care about our donors. We have to take care that we get all what we need to fulfill the needs of the patients, whether it's a patient for which gets a transfusion or PDMPs. I think we have to have a big picture in mind when we are discussing this issue and try to move forward. There are also some ethical considerations. I think Dr. Yuan has highlighted also the issue about compensation and financial neutrality. This is a bit the controversial situation between plasma donation and blood donation, but I think that's also a topic where we have to move forward, get some agreement on what finally is important and what finally is necessary to fulfill the patient's need. All that is about communication. Finally, also the donor has to be aware that his donation might be used for industrial manufacturing, or and also to explain probably also the public or the political decision makers more these concepts. And so these platforms and these initiatives we are having here on this UNITAR webinar, I think is just one piece in the whole element in the whole process. So I'm happy to share that with you and to be part of that process again. And with this, I can conclude my presentation. I'm happy to answer any questions at the end in the panel discussion. Thank you for your attention.
Thank you very much, Dr. Scherer, for this great presentation. I learned a lot. Before moving to our next speaker, allow me to remind you, please, you can use the dedicated Q&A feature for submitting your questions. It might get overlooked in the chat, so please use the Q&A box. And now we can move to our next speaker, and we will hear from Ms. Dita Novianti, who is the Director for Pharmaceutical Production and Distribution at the Ministry of Health of Indonesia, who will tell us about the challenges and opportunities of plasma fractionation in Indonesia. Please, Ms. Novianti, you have the floor.
Okay, thank you, Michaela. Okay,
Can you hear us?
I could hear you, Michaela, just to confirm.
Yeah, thank you, thank you. Ms. Novianti, we could have heard you in the very beginning, but we can't anymore. We can see the presentation.
She's on mute.
Yes, there is her secretary is sharing the presentation. Can we try one more time, Ms. Novianti?
I think she's trying to connect again, Michaela.
That might be possible. I can see her as connected. Christian, is your hand raised?
No, sorry, that was well.
Okay.
Sorry, no.
All right.
Can you hear me, Michaela?
Yes, we can hear you now. Perfect.
Sorry, I hope you can hear me clearly because it's heavy rain in Jakarta.
So I think
Mhm.
if I turn off the camera, and I hope the signal will be stable. Okay, thank you for the opportunity and thank you for invite us to this extraordinary event. With this presentation, I will inform you about what we have been done in Indonesia and what the next step will be taken to increase the plasma fractionation in Indonesia. As we know that now Indonesia MOH is committed to implementing a health system transformation through the six pillar. Start from primary to the secondary care transformation. And its support with the healthcare resilience, health financing, health talent, and also health technology transformation. In third pillars, health system resilience, we will focus to improve the resilience of pharma and medical devices sector, including the PDMPs. Indonesia is very big country with a huge population. It's more than 275.4 million people in Indonesia. For health services, more than 90% are covered by national health insurance. Indonesia is also have a good facility for pharma. We have more than 200 pharma industry, more than 2,500 pharmaceutical wholesaler, and other health facility in Indonesia. But with a very huge facility, we also have various limitations, including the dependency of imported raw material of production, because more than 90% of APIs for local pharmaceutical production are still imported in Indonesia, and including for PDMPs. We still imported 100% of PDMPs in Indonesia. And also we have limited research budget and a low access to innovative medicine. On average, new drugs enters to Indonesia is more than 3 years. I think it's longer than other countries in the world. As I mentioned before, that PDMPs in Indonesia, it's 100% import, but we already put the PDMPs in our national formulary list because it's very important to treat a variety of serious indication in Indonesia. As national formulary is a reference for medicines, we use in national health insurance. So if the product already listed in the national formulary, we will use is used in a quite large, and I think it will continue to increase. As we see in the graphic, the importation of PDMPs last 5 years is still increased, especially in 2021 during the COVID. It increases more than 10 times from the previous year. This is the data for 2023. We can see the import of PDMPs is reached about 1.2 trillion, and it's dominated by albumin, coagulation factor products, and also immunoglobulin. Considering this large market, we are working on the resilience of PDMPs in Indonesia. Effort to implement the local production in PDMPs is also an appropriate economic consideration. There are several notes on blood management in Indonesia. From the whole blood that we are processed into component to transfer services, it's only a small proportion of plasma, recovered plasma it's used. It's around 10%. And every year, about more than 100,000 liters of plasma is wasted with a destruction cost is around 2.5 billion. That is why we want to use our recovered plasma to be produced as PDMPs in the future. Currently, Indonesia is preparing to establish a contract fractionation and local production to fulfill the PDMPs needs. If we are referred to the WHO stepwise approach to improving the supply of PDMPs at national level, Indonesia is already in phase 3. When we already have a recovered plasma with a good standard, blood establishment already GMP, and the demand is being fully satisfied. I think it's time for us to initiate the action follow phase 2 from the WHO guideline. Plasma from a blood establishment in Indonesia now is prepared to meet the safety and quality requirement to be produced into PDMPs and increasing its volume to enable contract fractionation with overseas plasma fractionation facilities and continued with local production. This is the challenge and the strategies to establishing plasma fractionation facility in Indonesia. Until now, plasma fractionation technology is not locally developed and because it's need a very huge investment. And to combat this issue, we already invite domestic and foreign investors to build the local plasma fractionation facility in the country. And we also cooperation with overseas plasma fractionator to produce PDMPs through toll manufacturing and technology transfer to establish the plasma fractionation. A government also gives fiscal and non-fiscal incentive. It's prioritized for use in a government procurement. And we have to ensuring the availability of plasma that meet the safety and quality requirement for fractionation. We strengthen the regulation to improve the availability, safety, and also quality of the plasma fractionation. And we also implement GMP standard in plasma for fractionation production in blood establishment. We increase the number of GMP certified blood establishment to meet the need of plasma for fractionation. And we also increase the volume of plasma through plasmapheresis program, both for concurrent and source plasma. And we also do the capacity building for the blood establishment personnel, cooperation with the WHO, MFDS, Korean, and also other stakeholders. Thank you for our stakeholders. To improve the volume of PFF, as I mentioned before, we increase the number of the blood establishment certified with the BPOM. Also, this is the location. This year, the red one, it's the new one. The red one is just finished getting GMP this year. And in total, we already have 23 blood establishments spread in 12 provinces in Indonesia. The government also continues to strengthen regulation to support the development of PDMPs. In 2023, we have a new health law, which follow with the government regulation in 2024. From these regulation, we regulate to strengthening the role of blood establishment as producer of plasma for fractionation and increasing the volume of plasma for fractionation from donors or plasmapheresis, and also ensuring the safety and quality of PFF through the implementation of the plasma management standard and GMP certification. We also now we are also preparing for toll manufacturing. We already have two fractionator abroad, collaboration with the local manufacturer in Indonesia. In the toll manufacturing will be 2 years, and after that, we hope that the PDMPs already can produce in Indonesia. So I think this is the conclusion of my presentation. Number one, with a huge population, Indonesia has a very high demand of plasma-derived PDMPs. And on the other hand, Indonesia also had a potential to produce plasma and implement plasma fractionation program. Two, local production of PDMPs in Indonesia is one of the priority program in health system transformation to increase the resilience of the pharmaceutical sector and to reduce dependence of the imported medicinal product. And to master plasma fractionation technology, cooperation with overseas plasma fractionation has been carried out now. We hope it will be a success, the toll manufacturing in 2 years, and after that we can produce locally. To support the plasma fractionation program, some effort have been taken to ensure an adequate supply and to meet the requirement of safety and quality plasma for fractionation. I think that is my presentation. Thank you for the opportunity. Back to you, Michaela.
Thank you very much, Ms. Novianti, for this insight into Indonesia's plasma fractionation. And thank you also to all our speakers. These have been very insightful talks. So please accept our virtual round of applause. I hope our attendees learned a lot. I certainly did. And I also think that these presentations were great for setting the scene before the panel. So I'd like to ask my colleague, Dr. Sonu Bhatnagar, the Area Medical Director for Asia Pacific at Abbott Diagnostics, to take over and guide us through the panel discussion.
Thank you, Dr. Michaela. And once again, I really want to say thanks for all the speakers for sharing very informative experiences from their respective workplaces. And it's my honor and privilege to facilitate this panel. And we have panelists as introduced from various countries and divisions with lots of experience. So it is really my pleasure and honor. And I would like to start with our first panelist, Professor Dr. Taruna Ikrar, who is the chairperson of Indonesian FDA and professor of pharmacology at University of Malahati. Professor Dr. Taruna Ikrar is an internationally recognized physician, biochemist, and scientist and educator. And thanks, Dr. Ikrar, to join us today. And as Ms. Dita Novianti shared about the Indonesian initiative towards plasma and PDMP self-sufficiency in the country, it's my honor to start with you and to hear some of your insights as how Indonesian FDA is supporting that initiative. So, Dr. Ikrar, what do you think? How do the various innovations in plasma processing and transfusion technology are influencing the regulatory strategies and patient outcomes? Over to you, Dr. Ikrar.
Thank you, Dr. Sonu Bhatnagar. Ladies and gentlemen, honorable esteemed colleagues from United Nations Institute for Training Research, distinguished ladies and gentlemen, of course, it's an honor for me to have as one of the panelists to give response some about this discussion. To more easily and clear, I think I want to just show some slide, one or two, I think, so that is more precise to make us more understand about what kind of situation in Indonesia, and we can give more insight about discussion today. I want to start from this slide. As we know that according to the Indonesian regulation and also about the plasma fraction management, that plasma fractionation of GMP, or we say the good manufacturing practice, is the authority of Indonesian FDA. So like we saw that in Indonesia currently is 100% is import for plasma, and it costs about 1.3 trillion rupiah. That amount about 77 million US dollar annually. That is means very high demand in Indonesia. Because of that, based on our authority is Indonesian Food Drug Authority, we think this is a national interest for us. Based on that, our authority is to give the good manufacturing practice or a certificate for all of the GMP production Currently in Indonesia, we have about 23 facility to get the good manufacturing certificate. But the facility is not good enough to do fractionation because a lot of technology we need. Means one side, Indonesian need so much plasma. Another side, we have limited facility. Because of that, that is making us import 100% plasma. So, based on this data, we think to fix the problem, we believe to make this facility is currently established to can do to do fractionation. Especially, we do understand that from the blood, we can fractionize a lot of derivatives, include the plasma. So, I believe Indonesian FDA have a special strategy to support this condition to give some easily regulation, but we need to still keep to make sure is safety and a good quality product. Based on of that, we saw that the routine infection supervision from 2023 to 2024 from 71% routine infection, we had GMP certificate infection is about 29%. And belonging to our authority, Indonesian FDA, or we say BPOM, Badan Pengawas Obat dan Makanan, we have coordinate collaboration with the government, for example, Minister of Health, Director General for pharmacies and business and academic to increase or maximize or potentially about the plasma-derived from medical product by making the quality, safe, and efficient for this PDMP. We already did that one, but we want to increase our effort to make and to help the Indonesian people. Next slide. To answer about the question, the second question about how the future strategy to show the Indonesian condition currently, the Indonesian FDA developed established local vaccination. That is, I think, the best strategy. We to make not only to get the demand from import, but we want to product ourselves in Indonesia. So to make Indonesian can product vaccination about plasma-derived medical product, we do especially to local plasma vaccination to open the independent fulfill domestic needed. By we can do, for example, increase plasma supply short plasma fraction by Indonesian FDA conducting by regulatory assistance for food blood established to comply with the GMP standard. Mean we will help any industry, any facility to increase the GMP facility and make the get easy GMP. And after that, we can control and supervising the production. And then also, we currently there are several Indonesian Red Cross and hospital blood establishment and proposed in GMP certificate. Those blood establishment usually have a large amount of donation and receive support from the local government. Just for example, every year we have about 1.3 pocket blood transfusion, blood infusion from the Red Cross. And we collected that, and then we facilitated the facility to produce plasma. And then I think we want to start in the future from we import 100%, we can reduce gradually. Maybe in the near future, Indonesian just import about maybe 50 or 60%, and after that we reduce more and more. We have special strategy to invite the investor to come to Indonesia, is even local investor or foreign investor or international investor will open. And this belonging to also with our new government, a new leader in Indonesia, the new president, to open for this investment in Indonesia. A lot of facility we give for investor. And another thing, also we will establish the plasma fractionation for the PDMA for therapy. The issue regulation for blood product by develop specific regulation or a new guidance for the pharmacovigilance, because also we do understand this is very special issue, means critical for Indonesia. That's why we want to do whatever we can do for make Indonesian can be independent to get the PDMP or plasma. And the last one is we will collaborate during the development period. We will necessarily consider to create temporary mechanisms of implementing hemovigilance, we refer with WHO guideline, and the maker of the country of strong hemovigilance. And means we have the specific commitment to make Indonesian become independent for create and product plasma. As we know that about 1.3 trillion rupiah or about $100 million annually needed for this needed for Indonesian. And not only because about the money, but about we know that some patient need blood, some patient need plasma is critical and urgent. Can you imagine if we don't have result in Indonesia because the we say result chance is not ready? That is danger for the patient. That's why we belong to we do as we can. We collaboration with the Minister of Health to support this idea to make in the future in Indonesia can be product independently plasma product, derivative product of medicine. I think, thank you very much for the time. I appreciate, and that's all I can explain to you. Thank you.
Thank you, Dr. Ikrar, for sharing the Indonesian experience. Really appreciate it, and I really feel from my experience from Asia Pac that Indonesia can support other neighboring countries in Asia Pac and show how to establish their own national plasma program, as Dr. Ikrar and Ms. Dita has shared wonderfully. All my best wishes to Indonesia and for the successful program which both of you are leading and collating with the government of Indonesia. Thank you, Professor Ikrar. Okay, moving on, I would like to talk to Dr. Yuyun, our first speaker. Thanks, Dr. Yuyun, for sharing the new policy guidance initiative from WHO, which is kind of need of the hour for many countries on how to establish cross-border framework for plasma and PDMPs both ways, right? So Dr. Yuyun, could you share a little bit of your insights as you shared about the guidance which is coming up, that how the countries with established plasma policies can support the other countries who are still in the progress or who are still thinking of developing their framework within the context of the new guidance you are developing. And also, if you could share about, I know you shared brief overview, but do we expect that guidance will account for emerging challenges such as pandemics or geopolitical disruptions that might impact the cross-border plasma transfers? Over to you, Dr. Yuyun.
Thank you, Dr. Sonu. So before answering your question, I would like to congratulate Indonesia, which is also my own country. I'm so proud listening the progress of the project of plasma fractionation in Indonesia, which is one of my dream, of course. And to answer your question, first, of course, I think the country that's still developing their framework can reach out the country with established plasma policies. And between these two countries, they can, of course, set up the direct communication or discussion and also exchange the experience. If they have a difficulty to set up the direct communication, of course, they also can reach out to us, for example, to WHO or to other stakeholders such as the International Society of Blood Transfusion or UNITAR or EVET or any fractionator to help them to bridge the communication. And I think the communication or discussion should highlight the key aspect to include in the national plasma policies and regulations, addressing the quality and safety requirement for plasma as raw material, and also outlining the GMP standard that blood establishment or plasma collection centers must meet, because I think those aspects is very important and is a key to success the project. I think I can also give you the example that Indonesia has reached WHO to bridge the communication with the Ministry of Food and Drug Service of South Korea, and also to bridge the communication with the Korean Red Cross. So they learned a lot from these two agencies about the plasma master file and also about how the GMP is important to ensure the safety and quality of plasma. So I think that is just an example. And also I think Indonesia also has reached out WHO to assist them to contact with one of the consultant that has an experience in helping other countries to develop the local plasma fractionation or also the contract plasma fractionation. So I think that is what we can do. I think, of course, I'm sure EBET UNITAR are very welcome to help any country that need help. And regarding the emerging challenges such as pandemic or geopolitical disruption, unfortunately, are not specifically addressed in the current guidance, because I think WHO just last year has published the guidelines on ensuring the supply of safe blood and blood components during emergencies. So the emergencies here means that during the man-made emergency situation or also a natural emergency. And also we have established one document on ensuring blood supply during the disease outbreak. So these two documents actually already explain about the risk assessment and gap analysis when the country face the emergency situation, and also how the country can develop the mitigation and the preparedness activities to respond to the emergency situation. And if you ask me about whether the plasma transportation already discussed in this two guidance during the emergency situation, yeah, I can say not specifically mentioned, because I think this kind of situation is very specific to each country, because this challenge may vary from country to country depending on the level of emergency risk. So what I can suggest is maybe this kind of challenge need to be included in the agreement between the country that supply the plasma with the fractionator, because I think the country knows better what kind of challenge that oftenly faced by them related to the emergency situation, and also the fractionator, of course, can give advice how to cope with these challenges. So I think I hope I answered your question. Thank you.
Thank you, Dr. Yuyun. That's true. That WHO offering to support various countries for bilateral or multilateral conversations and help increasing the capacity and capability. And I agree with you for the pandemic and geopolitical disruptions that could be included and catered into the contracts, and especially PDMPs being part of WHO essential medicine list.
Yes.
They should be considered during these disruptions as essential medicine to which will require special permit to be transported. Thanks, Dr. Yuyun. And just building upon your comments and discussion, I would like to move to Dr. Krishnan Shire for excellent sharing on regulatory harmonization. Dr. Krishnan, from your presentation, I realized, and also I was going through the supply project report, which was recently completed, and also the publications which were made, that Europe has done quite a lot towards harmonization. But if we still see some of the papers which they had published, there are various models which exist for plasma and PDMP in each country in Europe, although having the European pharmacopoeia, various standards and regulations which you shared, which are kind of harmonized. I would like to open and give you time to share your experience and perspectives, what you could advise Asia Pac countries who are still, developing at a national level. Should they try to find a common platform such as ASEAN or APEC, where they can come up with some harmonized regulations which could help and expedite the development of plasma and PDMP access to the region. And so with that, I would like to hand it over to you.
Yeah, thank you, Dr. Zanu. Yeah, I think I wouldn't say that Europe is in the best position. So you highlighted the supply project, which is really indeed a signal to show that we also have to improve our concepts on the European level. Being from Switzerland, we are even not part of the European Union, so we are independent. We are a small country, and we fully depend on importation of plasma-derived medicinal products. We have a huge company in Switzerland as a fractionator, one of the global players. However, we do not have sufficient Swiss plasma to produce our own PDMPs out of Swiss plasma. So that just illustrates that there is only one way to work towards a comprehensive multinational approach, where on a regional level all the countries agree on a certain standard, and I think that is available in Europe, including Switzerland, that we make best use of the existing plasma fractionation capacity, which is already available to cover the patient's need. The big problem is still that Europe, and even including Switzerland, we do not have sufficient plasma collected to cover the needs of the fractionation. So fortunately, we are not wasting this plasma. So all the plasma which is not used from the transfusion area goes into fractionation. So that's already the good thing. But we have Europe and even Switzerland, we highly depend on US plasma, because they have plasma donation centers which are collected under different circumstances, and so I think what Europe is trying to work towards is really to increase the availability of European plasma, because there is still capacity. The use of blood components for transfusion is decreasing. Of course, this increase of plasma donations whether it's done in a private or in a public sector, I wouldn't discuss that. So I think the main important is that we are all applying the same donor selection criteria, the testing strategy, depending on the use of the product can be different. But I think that's what we are trying to work towards on the European level, especially this supply project you mentioned. This needs to be done in collaboration with the national blood organizations, because they also have needs for patients for transfusion. So we should not fight for the donors. It should be in collaboration, private or public sectors, to achieve as much plasma as possible while maintaining while covering the needs for transfusion, and then try. It's finally kind of a mathematical model I'm thinking of currently, to say, okay, how much plasma could we need to have, or how can we increase plasma collection, and how can we use the fractionation capacity best to cover the patient's needs. So I think there is still some international plasma movements towards markets which probably are using plasma for not the best reason, and some others do not have these products, are lacking these products. So I think we really have to think on a very high level, multinational level, to tackle this problem, and we cannot solve it on a national level only. So I'm really in favor of trying to form some kind of regional networks, regional concepts. Of course, the common standards should be the very first steps, and that is feasible, that is already here. It just needs a program to put these in place on a national level. And as we've seen on the Indonesian example, which is I congratulate also my colleagues. I have been there from the very first beginning, from doing some workshops with WHO and training for GMP. So I'm really happy to see the progress. I think that's really there is a need to have also the appropriate regulatory system behind. And if we do not recognize that, then we will always struggle in defining the standards and applying a harmonized approach. The regulatory body behind is finally certifying that the GMP compliance, which is a basis for using plasma, whatever purposes. So I think that's really a good way forward on working towards on a national, multinational level.
Yes, absolutely. Thanks, Dr. Krishnan. I just want to have a very quick follow-up question with you. You shared quite nice standards and regulations which are harmonized, including PICS, GMP with WHO. What I feel, and I would like to hear your take on it, is the challenges in aligning these plasma policy standards across countries which have a varying level of infrastructure and regulatory framework. So that's a challenge I see in APAC. And, that is a reason which drives them to develop their own regulations. And it puts, cross-border plasma fractionators a difficult situation. What will be your take on that?
My message was always, okay, we should define the aim. Where do we want to end up in assuring, for example, GMP? So we will never have a 100% GMP compliance, but we should have a common understanding what are the principles and where do we want to go to, what is the direction of achieving this. Is a very high level, which is currently agreed on. I fully agree, but I think each country has, depending on their national resources, also can have a different implementation time. We see now for Indonesia, it takes time. From my own experience in Switzerland, when I started 30 years ago, it took us 10, 15 years to have this level we have today, but we had to start somehow, and we were slowly but surely implementing the GMP from one year to the other. All the inspections we've seen from BPOM as well, each inspection was one step higher, and I think that's the decision of each country. how much time do they give their own to implement fully these GMP? And again, this is also something that has to be discussed together with industry, pressure fractionation industry, because they are finally the customer that are buying the plasma or using the plasma for their own purpose. So it's a process that can be developed together to implement the necessary quality into the plasma, and we do not have to aim to have 100% GMP. It is already good to have a program, stepwise approach to implement and to apply principles. And I think I see there is good movement in this area. But if we don't define the objective, I think we will probably never make big steps forward. So that we should have an objective and work towards that. We may give us 5 years, we may give us 10 years. That's up to the country's infrastructure and possibilities.
Absolutely. Thanks, Dr. Krishnan. That's well said. And that's where WHO guidance on stepwise increasing the PDMPs. So I think that's a good segue for me to move to Ms. Martine Pershawn. She is the current president of IPOPI, and Ms. Martine is representing patient advocacy group today. And as we say, there could take time, and there is a stepwise movement which could happen to develop the PDMP and plasma infrastructure for each countries. I would like to hear from you, Ms. Martine, from patient advocacy perspective. What policies do you see as most effective in ensuring equitable access of PDMPs to the patients? Over to you, Ms. Martine.
Thank you, Dr. Sonu, and thank you to UNITAR and to Abbott for inviting IPOPI to contribute to this important discussion. As the Global Patient Organization, we are dedicated to improving the lives of people with primary immune deficiencies, and IPOPI represents 75 national patient organizations from across the globe. And among my board, I have 2 patient representatives coming from that region, one from Malaysia and one from Indonesia. For the majority of PID patients, immunoglobulin replacement therapy is not just a treatment option, but a lifelong necessity, and these patients have no alternative treatment. So let me elaborate on how we could ensure equitable access to plasma-derived medicine products from our patient perspective based on our experience with immunoglobulins, also because immunoglobulins have become the driving product of the PDMP industry. So we need to recognize the need for more immunoglobulin and their life-saving role. Primary immune deficiency are recognized globally with diagnostic tests for PID, including in WHO list of essential in vitro diagnostics and immunoglobulin therapy listed in the WHO model list of essential medicines, highlighting their critical role in diagnosis and treatment. Access to PDMPs, particularly immunoglobulins, should be treated as a global priority. IG demand is growing annually by 6 to 8%, and this growth is expected to continue in the coming years. First, because we diagnose more and more, but still, it is estimated that 80% of PID patients do not have access to appropriate therapies on a worldwide basis, and we know that the patients are massively underdiagnosed in this region. And also we have to recognize the increasing prevalence of chronic diseases, notably secondary immune deficiency in need of IGs for fighting infections. Challenges remain considerable, especially in Asia Pacific, that represents 56% of the world population, but only 20% of the immunoglobulin consumption. Second thing I would like to highlight is patient-centered policies are key. As patient advocates, we must ensure that policies are designed with the patients at the center. Patient representatives must have a seat at the table in health policy discussions. And there I would like to highlight something which is very important for IG, and especially in this region. We need to access to a range of immunoglobulins, including subcutaneous, to ease patient treatment, especially for patients who live in remote areas. And we know that in this part of the world, there are so many islands. So we need to make them available for equitably to avoid further disparities. Third thing I would like to highlight is that we need to build a sustainable plasma supply chain, and plasma being a global resource, but policies governing its collection and use must ensure sustainability and equity. And we think that we need investment in plasmapheresis, and adherence to international quality standards are critical to scaling up plasma collection. Reducing wastages, of course, and fostering cross-border collaboration. And we heard very important and insight about that with the previous speakers. We need a regionally balanced collection to reach global sufficiency. We completely stick with the fact that there is no point to speak of self-sufficiency when it comes to end product within a country. Fourth, we need to advocate for universal health coverage. Many barriers to PDMP access stem from financial constraints. To bridge these gaps, we need that governments must include IG therapies in their national essential medicine list to guarantee prioritization. We need health insurance system, both public and private. They must offer full coverage for IG therapies to reduce patient out-of-pocket costs. And subsidized programs should be established when health insurance is inadequate or non-existent. 5, we need to drive awareness and diagnosis. Increased diagnosis rate is essential to improving access. And for this, we need that each country recognizes clinical immunology as an official discipline. We need to address the lack of specialist doctors, especially for adults, and the lack of transition care as well. We need also medical education campaigns, and this was highlighted previously as well. Last but not least, we need to empower national patient advocacy groups to seek timely diagnosis and treatment. 6, I would say that we need to strengthen global solidarity. Collaboration is key, and it must be guided by patient needs, donor safety and efficacy of PDMPs, and better understanding of the difference between blood and plasma and their derived therapies. We must recognize the complementarity roles of the public and the private sectors and encourage partnerships between them, which we see as a very pragmatic solution for developing access, especially in low and middle income countries. Finally, equitable access requires global commitment, harmonized regulatory frameworks, international assistance for low and middle income countries. And I think that partnership like the Asia Pacific Plasma Leaders Network and of course the Plasma for Life UNITAR initiative are key to advancing solutions. Equitable access to PDMPs is like IG therapy is not IG therapies is not just a health issue, it's also a matter of dignity, of human rights. And a plasma collection to policy implementation, patient need must guide every decision, and together through advocacy, collaboration and action, we can ensure that no patient is left behind, no matter where they live.
Thank you, Ms. Martin. Excellent. And I hear one common thread between all the speakers and the panelists talking about the international collaboration and the global need. That's very, very much true that we cannot be doing something at a region or national level, but we need to think about. And I really like what you mentioned is that patient advocacy oriented standards and policies. That's very, very much needed. Thanks, Ms. Martini. And for the benefit of time, I would like to move on with our next panelist, Dr. Mohammad Masreen, who is representing the Blood Services of Malaysia. He's the Director of National Blood Center and National Head of Transfusion Medicine Services, Ministry of Health from Malaysia. Thank you, Dr. Masreen, for joining us today. And I would like to give time to you to share as Malaysia initiative and to share your experience on how countries can balance domestic plasma self-sufficiency with global sharing mechanism to ensure there is no patient left behind, as Ms. Martin mentioned. Over to you, Dr. Masreen.
Thank you, Dr. Sonu. Hi, everyone. I'm happy to be part of the panelists for this session. And I also must congratulate our neighboring countries, Indonesia, for your progress of local vaccination. Yes, to answer Dr. Sonu's question for Malaysia, so let me open my video. Okay. For Malaysia, although Malaysia is still a long way towards self-sufficiency in plasma vaccinated products, the experience and the lesson learned that has helped us to be more aware of the issues involved in the plasma industry, as well in the particularly understand the issues of availability and safety. And for to answer this, how to balancing domestic plasma self-sufficiency with a global sharing mechanism, I would like to give 7 strategies to help the countries to balance these priorities. Number 1, and perhaps I get the idea also from the presentation just now by Dr. Yuyun, you will be presenting on the policy by WHO. First strategies is to building a robust domestic plasma collection system, whereby when to increase a donor in this, what we mean by building a robust domestic plasma collection system, where we wish to increase a donor engagement. Countries need to invest in the programs that encourage voluntary non-numerated plasma donations. And this can include an education campaign to raise awareness of importance of plasma donation, incentives to boost donation rates, and making plasma collection more accessible through clinics, mobile clinics, or improve infrastructure. And we also enhancing collection center, whereby we establishing more plasma collection centers and ensuring they are distributed equitably across the region that can help meet domestic demand and avoid relying solely on imports products. And we also improve donation efficiency, whereby through the innovation in plasma, this apheresis technology, which can increase donation yield while reducing burden on the donors, improving the efficiency of the domestic plasma collection. That's number 1. Number 2 is fostering global cooperation and sharing mechanism, whereby the international, for example, like International Plasma Network, the countries can participate in, for example, like International Plasma Vaccination Association, IPFA, or regional groups, and to share excess plasma resources with the nations that are struggling to meet their domestic needs. And also there's initiative of a plasma bank, where global plasma banks or pool plasma programs can be established, where countries with surplus plasma can donate it to the countries with higher demand. This ensures that no country is left behind in terms of access to essential therapies. Under this fostering global cooperation also, equitable sharing agreements such as bilateral or multilateral agreements between countries, organizations, and can help distribute plasma more fairly. These agreements should prioritize high-need areas, for example, low-income countries with inadequate healthcare infrastructure, while considering the needs of contributing nations. Number 3 is to diversify sources of plasma sources. This is to increase vaccination capacity. Some countries may need to expand their plasma vaccination facilities to ensure that a steady supply of therapies from their own plasma collections. Increased vaccination capacity can allow them to process plasma locally, creating more jobs and strengthening the self-sufficiency. And like Dr. Sharon mentioned just now, and there's also collaborations with the private sector, whereby this public-private partnership, the PPP initiative, can play a crucial role in increasing the availability of plasma-derived therapies. Number 4 is to ensuring access for all populations. This is by what we mean that there's a tiered pricing models. Companies that produce these plasma-derived therapies can adopt a tier pricing systems based on purchasing power of the different countries. This could help the lower income countries access a plasma product at a more affordable cost, despite high cost of vaccinations and productions. And government subsidies, and this is for Malaysia also. The governments can provide subsidies to ensure equitable access for vulnerable populations. This could include health insurance coverage for patients who require regular plasma-derived treatments. So I discussed already 4 strategies, and I go to number 5. For number 5 is a sustainable investment in the global health, where these wealthier countries and international organizations should invest in improving plasma collections, healthcare infrastructure, capacity building for the staff built through a training program in low and middle income countries. This will help those nations build their domestic capacity to meet plasma demand over time. And like Dr. Eugene mentioned this just now, for the chapter number 7, there's a cross-border transfer. For cross-border transfer also at cross-border aid programs, some countries may choose to directly donate or supply plasma products to others through humanitarian aid program. And I'm sure everyone of us know about this effort can be coordinated very well by international organizations like Red Cross. And this is something technology, current technology we must also include, and this will come number 6 strategy, whereby there are data and forecasting for our better planning, whereby for when we have the data, we can have the accurate and real-time data on plasma collections, and utilization, which countries can help to anticipate shortage or surplus. This platform that can track global plasma distribution that can improve decision making and ensure that plasma products are distributed where they are most needed. And also there are the tools for forecasting when we can also do the predictive analytics which can be used to anticipate future demand for plasma-derived products and guide both domestic collection efforts and international plasma sharing programs. This would allow countries to plan ahead and prevent shortages. And last, this number 7, under chapter 3, there's an ethical consideration and fair for ensuring fair access. There needs to be a strong ethical framework in place that prioritize patients' needs over the national interest. While countries aim to ensure that domestic sufficiency, the global nature of plasma demand require a cooperative approach to guarantee that no patient is left behind. And so perhaps these are the 7 strategies and that I can share. So over to you, Dr. Sonu.
Thank you, Dr. Masreen. I think very nicely shared and summarized what could be the various global level international cooperation strategies to make sure there is equitable access to the patients. I really liked what you touched about, Dr. Masreen, is having a stratification of the cost of the products, so that different strata of patients can access. And I feel that's the biggest challenge when it comes to privatization of plasma products, that it becomes accessible to higher income countries, and it becomes challenging for LMIC countries to have enough of access to these products. So thanks for highlighting all those issues and sharing your insights for the strategies. Thank you so much, Dr. Masreen. I would like to move on and also open the floor to Dr. Robbie Noor Aditya, who is the Vice Head of Central Blood Transfusion Services, Indonesian Red Cross from Indonesia. And as Dr. Masreen just now talked about the various partnerships and collaboration we've been talking, that's the common theme all the speakers and panelists talking about. So Dr. Robbie, from your experience, if you could share the role of partnerships between the public institutions and private stakeholders, what they play, what could be the future as they play partnerships in improving plasma collection and distribution from Indonesian perspective. Over to you, Dr. Robbie.
Okay. Thank you, Dr. Sonu. Dr. Sonu, yes? My voice, okay.
Yes, we can hear you, Dr. Robbie.
Thank you, Dr. Sonu, and then UNITAR, and then Ebert to invite us to join this excellent forum talking about the future of the plasma fractionation. So the question is about the public and private partnerships for the plasma collection and distribution in Indonesia have a crucial role, very, very crucial role in Indonesia, because it's mean the public, it's mean government, and then the private partnership is like private stakeholders. So I think this partnership can have the challenge to addressing the challenge of the plasma supply, and then improving healthcare access, and then ensuring the sustainability of plasma-derived therapies. So there is some issue or benefit from the role of public-private partnership in Indonesian perspective, that one is the impact of this partnership is resource of mobilization. So private-public partnership can pooling the resource from the public institution and the private companies. So this collaboration can lead to increase the funding, the funding of plasma collection initiatives, and then infrastructure development and the training programs for the healthcare that involved in the plasma donation and processing. And then this collaboration can have benefit on the capacity building. Yeah, in our side, in our perspective, that private stakeholder usually bring or have some expertise in operational efficiency and technology. So this example that companies can involve in the plasma collection and can provide training and technical assistance to local health authority. So it can enhancing their capacity to manage plasma donation effectively. So that's the capacity building. And then what the other benefit is quality improvement. Yeah, with the public and private collaboration, this involvement can help establish quality. The private entities can help establish quality, especially quality control measure that align with international standards. So like this workshop organized by WHO and then IPFA, International Plasma Fractionation Association, usually emphasize the importance of the quality system and GMP compliance. Yeah, it's mentioned by Dr. Christian and Dr. Yun about the importance of quality for the plasma fractionation. And the last, what the benefit from the collaboration between private and public institution, that innovation and technology transfer. So private company can have access to usually have access to advanced technologies that can improve the plasma collection methods. So by partnering these entities, like Indonesian public can have access, and health system can adopt the innovative practice that streamline the operation, such as like automated donor recruitment system or enhance the screening technologies. Yeah, I think that's benefits from the public and private partnership in the Indonesian perspective. That's Dr. Sono.
Thank you, Dr. Robbie, and I couldn't agree more. That's true, and it is very, very, I think, relevant for low and middle income countries that we support and encourage the private-public partnership. However, having said that, we heard from other stakeholders, and it is the need for every country. So it's not just APEC region, but we see that from Dr. Shire's presentation, Dr. Yuyun's presentation, even Ms. Martin, as she mentioned, global partnerships, private-public acknowledgement of the need of the partnership is needed to drive this initiative and, of course, to make PDMPs accessible to the patients and have the equitable access for them. So thank you so much, Dr. Robbie. And I would like to move on to our other panelists from Vietnam. Ms. Vo Thi Ha. She is the head of Blood Processing Department of National Blood Center from National Institute of Hematology and Blood Transfusion, Hanoi, Vietnam. Thank you, Ms. Ward, for joining us. And I would like to hand it over to you to share your experience and your thoughts on, as we are talking about the partnerships, how could global health stakeholders assist Vietnam in setting up policies that can align with the international standards for plasma safety and utilization? And any further thoughts on what policies and regulatory changes Vietnam is prioritizing for the using of plasma in PDMP production? Over to you, Ms. Vo.
Yeah. Hi, everyone. Thank you for being here today. It's a pleasure to see so many of you here. Thanks for your taking the time to join us. I'm excited to share with you some insight, and I'm very thank you for this important question. As a representative hospital, I focus mainly on the implementation of policy rather than their creation. The development of regulatory frameworks for plasma safety and utilization falls under the responsibility of the Ministry of Health. So, however, from my perspective, I see great value in the learning from international best practice and experience. Collaborations with global health stakeholders could provide Vietnam with valuable insights and technical assistance, particularly in areas like technology transfer, training, and infrastructure development to meet the international standards. I believe it's crucial to continue fostering dialogue between stakeholders, including the Ministry of Health, healthcare providers, and international experts, to create the policies that are comprehensive and aligned with global standards. I'm confident that with the collective effort, Vietnam can make this significant progress in this area. Thank you so much.
Thank you, Ms. Vo. Completely agree. And thanks for sharing the need for global collaboration and which could help the countries like Vietnam. I would like to open the floor to our another representative from Vietnam, Dr. Hoang Thi Ha. She is the Deputy Director of Blood Transfusion Center from Chorai Hospital, Vietnam. Welcome, Dr. Hoang. And I just would like to open it same question to you as Ms. Vo mentioned, and what will be your perspectives on setting up the policies aligning with the international standards in Vietnam, and what do you foresee Vietnam is moving forward from plasma and PDMP perspective?
Thank you, Dr. Sonu. Good afternoon, ladies and gentlemen. For me, it is very difficult to talk about this sensitive topic. Sorry, because I'm not a policymaker, but in Vietnam, we have high demand on DPMPs, but all the DPMPs aren't important. We know that there is insufficient supply of appropriate anti-hemophilic medicinal products as well as IVIG, but at the same time, large volume of plasma are discarded. This challenge arises from a lack of technical and financial capacity in implement contract or domestic plasma fractionation program. When considering a strategy on how to improve plasma availability, the needs of patients should play a key factor in determining the optimal collection of blood and plasma in order to maintain safe blood availability for transfusion while focusing on improving the plasma availability. There is need to increase the availability of high-quality plasma for fractionation, and also an urgent need to improve GMP plastics so as to enable fractionation into products for patients. For plasma availability to improve, it is also important to have a multi-stakeholder collaboration and dialogue around the key issues pertaining to regulation, legislation, and policy, and focus on patient-centered approaches. Access to PDMPs in Vietnam could be increased if there was a contract fractionation program in place. However, this is currently not possible in Vietnam. You know, such a program would require high investment. So we are looking forward to being supported by pharmaceutical companies, for example, as a bridge to plasma manufacturing factory abroad. For example, Mr. Hiếu Nguyễn from abroad, we provide safe plasma and receive the PDMPs back, I hope. They also need to further develop GMP in Vietnam. Blood establishment as present, only one hospital in Vietnam carry out the GMP plasma production, like BTS blood transfusion hospital in Ho Chi Minh City. That's all. Thank you.
Thank you, Dr. Hong. Excellent what you concluded. There is a lot of need, and I would like to congratulate Vietnam for excellent blood services. And just for our international audience and panelists who, if you have chance, go and see the wonderful work the blood services are doing and the National Blood Program, which has been developed. So there is I will say the need to develop, as Dr. Hong is elaborating, need to develop a contract fractionation where blood services could contribute to this valuable natural national resource of plasma and make PDMPs available to the country. Thank you so much, Dr. Hong, for sharing. And with that, it's my opportunity to thank all the panelists for today. And thank you all for your insightful contributions to today's panel. We dwelled into the global disparities in the various plasma policy frameworks. I think we all talked about international stakeholders, how they should collaborate and create a unified approach to make these PDMPs accessible globally. As we move forward, I'll just say that let's remain committed to these collaborative efforts and innovative solutions. And I believe together we can overcome the challenges and ensure life-saving plasma-derived medicines are accessible to all who need it. Thank you once again for your participation. And I would like to hand over to my colleague, Dr. Michaela, for closing. Thanks.
Yeah, thank you very much, Sonu. So seeing that we have more than exhausted the time allocated to this event, I won't keep you for long. But I really think it was an excellent and very important discussion. Thank you, everyone, for emphasizing the need for international collaboration on this. It's definitely what we have seen in the past few years that we have been working in this field. That definitely this is the way forward. So thank you also to Abbott for co-organizing this event, and I would like to thank one more time to our wonderful speakers and you all for being with us today. And I would like to invite you to stay in touch or send us your feedback through our platform Plasma for Life. And I hope to see you soon. Thank you again, and this meeting has ended.